if it ties in with all the information that we've got, and of course, a gravity pattern in the way we would describe it is also known as a pronation pattern or an overpronation pattern. And so a lot of people have heard of pronation in the foot. And that means essentially that your foot's going flat, too flat, when you're walking or running or jumping or even just standing. And that's an indication that essentially the muscles that prevent pronation, which are the supinator muscles, they are not doing their job properly. Okay. And so a gravity pattern is where either statically, but more commonly dynamically, the person is unable to resist gravity, and so they're going into an overpronation. So that tends to mean that the foot will collapse. But also what happens as part of that pattern is the knee tends to roll inwards. And as the knee rolls inwards, it puts stress onto the medial collateral ligament of the knee, onto the medial meniscus of the knee, and onto the anterior cruciate ligament of the knee. And so then, if you look at, well, what is it that stops that knee from rolling inwards? There's a bunch of different muscles that are involved, but locally to the knee, it's the biceps femoris. So the biceps femoris is the reins. So remember, you've got the reins on the horse, and you've got the medial hamstring group on the inside of the knee, and you've got the biceps femoris on the outside of the knee. And to stop that knee from rolling inwards, it's the biceps femoris that has to pull. And the other key element of this is that if you were to load that leg and it rolls in, because gravity's trying to pronate you, and you're using your muscular system to prevent that overpronation. But it means that biceps femoris is being engaged eccentrically. And one of the things we haven't mentioned too much yet is that it's the eccentric phase of contraction, which is where muscle strain tends to occur. It doesn't really happen in the concentric phase. So it's in that eccentric or lengthening phase of loading the muscle. So that's essentially what is a very strong contender for the primary cause of hamstring strains, this inability to effectively resist gravity. But that obviously is complex, and there's lots of elements to that, from core function, which is one of the key things, in particular pelvic control, so avoiding an anterior pelvic tilt under load, because as the pelvis tilts anteriorly, which is like it kind of, if you imagine the pelvis like a bowl of soup, tilting it forwards would be the soup would come out the front. So that's an anterior tilt. That couples with this gravity pattern or pronation pattern, also known as medial rotational instability. So the core is very key in that, in preventing anterior tilt. But so are the glutes, which we mentioned earlier. They're often somewhat deconditioned or relatively deconditioned compared to the quads. And the quads pull the pelvis into this gravity pattern, unfortunately. So there's a bit of an issue there. And, say the glutes kind of colloquially, but of course they break down into glute maximus, which is heavily involved in preventing this overpronation pattern. And one of the things we should probably mention there for the anatomy buffs is that, the glute maximus is obviously mainly considered a hip extensor and a lateral rotator of the hip. But it inserts into the iliotibial band. And for many, many years, in fact, still in most anatomy classes, you'll just learn that, it pulls a bit on the iliotibial band, but it doesn't have a particularly strong action. And that's because most anatomy has been done historically on a cadaver that's laying in a neutral position, let's say, just laying supine on a table. But if you put that cadaver, or indeed a live human being, into a gait type pose, or a lunging type pose, or a squatting type pose, essentially with hip flexion and knee flexion, then what you see is that the fibers of glute maximus, they actually run directly into that iliotibial band. And the iliotibial band, which is this band of tissue that runs down the outside of the thigh, it's the bit that's often extremely sore to foam roll if you do that kind of thing. It goes all the way down to the tibia again, and it kind of facilitates what the biceps femoris does, which is to prevent this medial rotation or inward rotation, this gravity pattern at the knee. So you can see, well, hang on, if my glutes are deconditioned, well, what's that going to put stress onto? It's going to put stress onto the biceps femoris again. So now poor old biceps femoris is doing the role of multiple muscles potentially, and it ends up getting strained.